Thank you, Rena. Music legend Neil Diamond startled fans recently by announcing he is retiring from touring after being diagnosed with Parkinson's disease. The musician says he's made the decision based on the advice of his doctors. Diamond says he will still plan to continue writing and recording. Dr. Eleanor Orehek from Neurological Clinic and Abbott Northwestern is here to discuss what life is like for people living with Parkinson's, as well as the latest developments in dealing with the disease. Welcome. It's good to have you here today.
Thank you. Happy to be here.
If you would begin, please, with a definition of what is Parkinson's.
So Parkinson's is a slowly progressive disease that affects the brain and evolves over years, and it causes loss of brain cells in an area of the brain that disrupts a circuit involved in motor control. So people have a harder time over years moving normally and fluidly, and there's about 60,000 patients diagnosed with Parkinson's each year just in the U.S. So it can be an isolating disease, but it's helpful to remember that you're certainly not alone, and there's resources and people out there going through the same struggles.
So those symptoms begin sometimes with tremors. Is that how that would happen for some people?
So some people, yeah, I mean, tremor is a very recognizable symptom, and so it often starts with a tremor in your hand, but there's 30% of patients that don't have any tremor, so you don't need tremor to have a diagnosis of Parkinson's.
Who's at risk of developing it?
That's a tough question. We're still trying to sort that out. I mean, it's a complex disease, so there's not really a simple answer to that, but we know things like older age is certainly a risk. We're looking at pesticide exposure, head trauma, things like that increases your risk, but it's a combination of genetics and environmental factors.
Men more than women?
Men a little bit more than women. I wouldn't say like you're out of the woods if you're a woman, but...
Talk about dealing with it and living with it, because Neil Diamond made it very clear that he still plans to continue to be creative.
Yeah, and it is a different struggle for everybody, because everybody's at a different stage in their life and coming to the table with their own things like trying to sing or trying to work or raise kids, and so it impacts everybody differently. And in early stages, depending on the medication plan you're on, it can have a very manageable effect on your life, and then as it progresses, it gets more challenging to live with.
Many Parkinson's patients though live very long and live very productive lives.
Yeah,
Michael
exactly.
J. Fox among others.
Yeah, for years with the right medications and exercise and treatment plan, you can be very effective.
And the important thing you want to say here today is that if you suspect any of these things, you see any of these symptoms, you can get checked out. There are ways that can determine whether you have this or not.
Absolutely. I mean, we diagnose it based on your symptoms and exam findings, and the more specialized the person is at seeing patients with Parkinson's, that increases your accuracy of diagnosis. So that's a good thing to get checked out if you have concerns.
Well, thank you for educating and enlightening us today. It's important, and there are things happening in this, which is such good news there.
Thank you. Happy to be here.
Thank you.
Yeah.
We have posted information about Parkinson's at KARE11.com. Look for the information under shows, then the menu tab, then the news at 4. Well, coming up